The Ohio Department of Health has now recorded 8,962 COVID-19 deaths since the pandemic began. Health officials confirmed Ohio's first cases of COVID-19 March 9th, but they suggest dozens of people were likely infected long before that. State numbers show there were 280 probable cases before March 9th, dating as far back as January 2nd. And the state recorded one probable death from coronavirus March 1st, 18 days before the first confirmed death was even reported.
And Victor Young was one of those early cases in Northeast Ohio, and the cancer survivor also became a COVID-19 survivor. News 5's Katie Houston shows us how he beat the odds and overcame 2020's biggest foe.
With every breath, Victor Young is filled with gratitude. For every breath is a reminder of life. It wasn't too long ago life sounded like this. A ventilator did the breathing for Vic. COVID-19 nearly killed the 64-year-old.
I shouldn't be here. I mean, I was that sick.
In early March, Vic's wife Marguerite was among the first confirmed cases of the coronavirus in Ohio. Despite their best efforts to quarantine, Vic became sick too. While Marguerite recovered at home, Vic's symptoms were more severe. One night, he was rushed away in an ambulance, unable to breathe or say goodbye to his wife of 21 years.
I didn't see him for 14 more days. It was dark. It was darkness. That's what I tell everybody, the darkest time.
It had to be.
Yeah.
It had to be.
Vic was put into a medically induced coma at Cleveland Clinic Marymount Hospital and placed on a ventilator to keep him alive.
You're mentally aware that you're trapped, and you feel like you're trapped inside of you.
He says he felt no pain, but remembers it feeling like a horror movie.
My brain was working full blown, but nothing else was.
But he could hear and says the voices of his doctors, nurses, and specialists constantly talking to him were a saving grace.
Even though I'm totally not responsive, they would talk. I can't tell you how much that mattered. It sort of broke up isolation.
He says he never felt alone, despite being unable to have family by his side due to COVID-19 restrictions.
The level of deep empathy was palpable and was just, it was overwhelming. I don't know how you say thank you for caring so deeply, because they just did.
Vic was on a ventilator for 12 days. He lost 25 pounds and has worked tirelessly to regain his strength and life.
I am the ultimate incrementalist. So I actually believe that there's nothing I can't do if I do it slowly and consistently.
Dr. Debasis Sahu is Vic's pulmonologist. He says Vic never lost hope that he would heal and credits a change in diet, exercise, and never missing a day of physical or pulmonary rehab.
Any patient that you see recover to the extent like Vic has recovered makes you feel proud of what you are doing, gives you the energy to sustain working harder to take care of these sick patients.
Vic was one of Cleveland Clinic's first coronavirus patients to make it off a ventilator alive. Dr. Sahu says when the pandemic started, the learning curve was huge, and Vic was among the early coronavirus patients who have helped create care plans to improve survival outcomes today.
We've learned a lot on managing with medications, managing how to use the ventilator, right? And our experience has taught us and helped us heal these patients better.
A near-death experience puts things into perspective.
My worldview is the same, but my sense of urgency has been probably ratcheted up even another notch. The time that I have been given, I need to make sure is used to sort of help make this place better or leave it better when I do finally leave.
Faith was this couple's cornerstone before the pandemic, and they say surviving the unthinkable has only made their foundation unshakable.
I'm just thankful for him. My life was better the moment I met him. So I'm just so thankful that it was God's will for him to still be here.
In Cleveland, Katie Houston, News 5.